This video segment that I am preparing is to show you and to inform you of the fact that this is the liver of the patient. It has been labeled by, anyways, leave it. But I want to say you that not every liver with diffuse increased parenchymal echogenicity and is surrounded by fluid is not cirrhotic. Not every liver. You have to see certain parameters before labeling it as cirrhotic. Now this liver is appearing brighter than normal. Why? Now remember that whenever you see fluid surrounding the liver, as it is in this case, the echogenicity of the liver will appear more as compared to that of the normal. Why? Because the speed of the sound increases in fluid. So when the waves reach this area, the outer surface of the liver, they pass with such a speed that when they strike the liver and go back, they give it a brighter appearance as compared to the normal. What you have to see, you see that what is the status of the vessels, number one. And in this case, you will see that the vessels give sharp margins. This is a vessel. You can see the sharpness of the vessel, and there is no coarseness. And see one must see the diaphragm. You see this diaphragm is not that thin, and moreover in this case see the portal vein. This is the portal vein. Its outer surface shows normal periportal echoes, and then compare it with kidney. Now you see, as there is fluid, the liver is appearing brighter. And then the most important parameter is to see that what is the status of the outer surface of the liver. Now you see, this is the liver. This is a part of the glycine capsule shining, and you see that the outer surface is smooth. This is the fluid surrounding the liver. So the information to be passed is that not every liver that appears bright is a cirrhotic liver. And the second point is that the liver surrounded by fluid will give you raised echogenicity as compared to the normal because of the speed of sound while it's traveling in this region where the fluid is surrounding the outer surface of the liver. So be careful while labeling such liver as being cirrhotic. Thank you very much. This ultrasound study is in fact to inform you that whenever the liver is being surrounded by ascitic fluid, as here you can see, this is the outer surface of the liver and this is the fluid surrounding it, that you have definitely the liver is appearing as to be having diffuse increased parenchymal echogenicity, whereas I can tell you that this is a normal liver. Now why it's appearing fatty? See, it's appearing fatty. It is not fatty in fact. The reason is that when the fluid, when the sound waves travel this fluid part of then its speed raises. You know, when it strikes this region, the speed it does is reduced. But when it reaches here in this area, the sound of speed again picks up to the extent that it strikes the liver parenchyma and goes back to the transducer with such a frequency that it gives you an echogenic appearance, whereas not every liver having diffuse increased parenchymal echogenicity is a cirrhotic liver. Now this is not a cirrhotic liver at all. I'm going to show you the exact picture This is a patient with ascites only, with no other finding. Now you can see that I will see is that what are the vessel margins? Vessel margin is sharp. Outer surface of the liver is smooth. Echogenicity is homogeneous. There is no vascular. This is the right and left portal vein showing you normal portal vein. Periportal echoes. Right diaphragm shows normal brightness. If you know the normal, that's why I repeatedly say be as perfect as possible. 200%. You should be well trained in the normal study. So if you know the normal, then this is normal liver. Diaphragmatic echogenicity, and the IVC is not dilated. This is the IVC. This is the gallbladder. This is the gallbladder, fluid around it. The hepatic veins are not dilated. These are the hepatic veins. No paraortic plan retinopathy. This is the aorta. This is mesenteric artery rising, celiac axis. No portal-hepatic region retinopathy. You can see this is the pancreas, mesenteric vein, aorta, IVC. So the point to study in this video segment is that not all liver with normal liver can be considered as being fatty or cirrhotic if you are unaware of this fact. So this is a normal liver. Thank you very much.